So we're off to the story now. In the Eastern Cape, we're off to the story in the Eastern Cape as the province continues to grapple with the shortage of doctors. A letter circulating online claimed that the Oliver and Adelaide Tambo Regional Hospital in Bizana may soon be without doctors from January the 20th, forcing patients to be transferred to the nearest facilities. The AM report producers have spoken to a nurse at the hospital who confirmed the letter's authenticity. However, the Eastern Cape's Health Department has dismissed the notice as fake. The question remains, who is telling the truth? To discuss this further, we are joined now by Lerato Mthunzi, the General Secretary of the Health and Allied Workers Indaba Trade Union. Lerato, a very good morning to you. Thank you so much for making time for us. So the spokesperson for the department saying that as far as they're concerned, this is fake. And when we pointed out, but the letter was actually on the notice board in the hospital, he said that, well, just because it's there doesn't necessarily mean that it's not fake. And we also know that it has the signature of one of the officials of the hospital, Mr. Chaga. According to your understanding and speaking to some of your members, what do they know about this notice?
Good morning, Aldrin, and to the viewers at home. Look, I think the hospital or other departments' PR is very, bad at their job, because genuinely, these are communications that are circulating, not only in this hospital, but I know across other provinces as well, hospital by hospital. I can guarantee you that that letter is definitely authentic. And the understanding is that these letters will not go out because they're just meant for the few people in that particular facility. I mean, it's the same situation in Telemokharane where when other hospitals are absorbing doctors and nurses, they have been let off by the end of this month, and it's supposed to be something that is put under the rug. So definitely the workers are telling the truth, and it's out of really frustration that they are put in this situation.
Yeah, and at the Oliver and Adelaide Tambo Regional Hospital, do you know, once again, how the hospital finds itself in this particular situation? I know that you speak of other hospitals also facing a similar situation, but what about the Oliver Adelaide Tambo Regional Hospital?
Look, the Eastern Cape has struggled over the years to employ, doctors in correct ratios. This hospital particularly relies on nearby facilities to take over the patients that cannot be seen by doctors in that particular facility. And I think the healthcare workers in this particular facility they're very open about it, and they've been complaining to management, and all they're getting is just a cold shoulder. They're not getting any assistance at all. And I think this action is really out of frustration, like I said earlier.
Yeah. What's the impact that this has on the patients who require the assistance, but also on the nurses? Because the expectation sometimes from the patient is that, listen, you work for the hospital, I need help.
The ratio of nurses themselves are low. So when there are no doctors, it means more burden of work falls on the lap of the nurses. But the biggest loser at all material times is the end user, who is the patient. Poor patients that are supposed to be getting some sort of health care, I won't even say quality health care, they actually end up in a worse of situation. I mean, we're losing lives that actually could be saved, and we are postponing surgeries that could have saved other people's lives, and people end up dying in ambulances because they've got to be transferred even in longer distances. So yes, the patient is the biggest loser in the situation.
Yeah, and we know, of course, about the doctor shortages nationally. When we spoke to the Minister of Health, he said that government does not have any obligation to employ the unemployed doctors. But here we have a shortage of doctors. Government says that we don't have the money to employ them.
I mean, absolutely irresponsible. Why do you take the taxpayers' money and train those doctors? The doctors in our country are trained through the money of taxpayers, and once they qualify, they ought to come back and serve the communities. It makes no sense that the Department of Health at National believes that they've got no obligation to actually save lives. It's entrenched in the Constitution. They've got the biggest obligation, and unfortunately, in the past, we've taken them, we've joined forces with other organs to take them to court, and this will not be a separate or a different situation altogether.